warahmatullahi wabarakatuh. Hello everyone and welcome to my presentation. First of all, let me thank you all for coming here today. Let me introduce myself. I'm Ratih Rahmawati, a diploma student of Health Polytechnic Bandung, majoring in Nursing Department. As you can see on the screen, today's topic is of particular interest to those of you who have family or friend with schizophrenia, or maybe even yourself. The purpose of this presentation is to make people believe that people with schizophrenia are not something dangerous, and not labeling people with schizophrenia as crazy. I've divided my presentation into 6 main parts. They are definition, symptoms, phase, diagnosis, cause, and the last is treatment. My presentation will be take 20 minutes, and don't worry about taking notes. I have put all the important statistics on a handout for you. If you have any question you'd like to ask, and I'll be happy to answer them. Okay, now try for a minute to imagine this. Your day is going as usual. Everything looks normal. You feel comfortable. But suddenly, the room around you goes dark. You start to hear voice and the world around you doesn't look quite right. How would you react? Perhaps you are afraid. Now imagine if this event occurred every day of your life. This is the reality of some people with schizophrenia. What exactly is schizophrenia? What causes it? How do you treat it? To answer this question, let's follow my presentation. First, I will tell you about the definition of schizophrenia. Schizophrenia is a chronic psychiatric disorder in which a sufferer experiences hallucinations, delusions, confusion in thinking, and change in attitude. Generally, people with schizophrenia experience symptoms of psychosis, which is difficulty distinguishing between reality and thoughts on themselves. This is what makes schizophrenia equated with psychosis, even though the two are actually different. Psychosis is only one symptom of several types of mental disorder, including schizophrenia. And then, I will focus on schizophrenia symptoms. In general, the symptoms can be divided into the 3 categories. Those are positive, negative, and cognitive symptoms. Positive symptoms are those that make change to a person's behavior and thoughts. For example, hallucinations in which you hear, see, or even taste something that isn't there. Negative symptoms are when you feel apathetic towards your surrounding environment. You may feel empty or unmotivated to do anything. Cognitive symptoms are more difficult to see. In general, these symptoms prevent you from completing daily tasks. Next, about phase of schizophrenia. People with schizophrenia seems to cycle through 3 phases typical in order. During the prodromal phase, patients may become withdrawn and spend most of their time alone, and often this seems similar to other mental disorders like depressions or anxiety disorder. During the activity phase, patients experience more severe symptoms like delusions, hallucinations, disorganized speech, disorganized behavior, or catatonic behavior. Following an active phase, patients often enter into a residual phase where they may exhibit cognitive symptoms like not being able to concentrate or becoming withdrawn again, as with a prodromal phase. So, how to diagnose schizophrenia? For an official diagnosis of schizophrenia, patients need to be diagnosed with 2 the following symptoms. They are delusions, hallucination, disorganized speech, disorganized behavior, or catatonic behavior are negative symptoms, and at least one of them has to either delusions, hallucinations, or disorganized speech. So basically, they couldn't have just disorganized behavior and negative symptoms, even though some patients have cognitive symptoms as well. They are not specifically needed for a diagnosis. Also though, for a diagnosis, signs of this disturbance must be ongoing for at least 6 months, meaning they're likely in one phase or another for 6 months. But there must be at least 1 month of active phase symptoms. And finally, the symptoms can be attributable to another conditions like substance abuse. Now that we have diagnosed it. And then, why do people get the schizophrenia? First, genetic factors. Offspring of people with schizophrenia have 10% higher risk of developing of conditions. The risk increased 40% greater when both parents were schizophrenic. Meanwhile, twins in which one of them has schizophrenia will have a risk up to 50% greater. Number 2, complications of pregnancy and childbirth. Schizophrenia can be caused by several conditions that may occur during pregnancy, and the impact will be seen when the child is born. These conditions, such as exposure to toxins and viruses, a mother with diabetes, bleeding during pregnancy, and nutritional deficiency. Apart from pregnancy, complications that occur during childbirth can also cause a child develop schizophrenia. For example, low birth weight, premature birth, and asphyxia or lack of oxygen at birth. And number 3, chemical factors in the brain. Imbalance of serotonin and dopamine levels in the brain can be one of the causes and increase a person's risk of developing schizophrenia. Both are chemical and function to send signals between brain cells as a part of neurotransmitter. In addition, people with schizophrenia also have different in brain structure and function compared to people who do not have mental disorder. These differences include there are the ventricle of the brain, the temporal lobe, and then cells. Okay, first, the ventricle of the brain is a large in size. The ventricle are a part of the brain that is filled with fluid. And then, the temporal lobe is smaller in size. Memory in the human brain is related to temporal lobe. And then, cells in the brain have fewer connections. Now the last is treating schizophrenia. Treating schizophrenia can be really tricky, and antipsychotic medications are often used, but it's super important to combine the efforts of several clinical and health professionals, including professionals in therapy or counseling, medicine, and psychopharmacology. Antipsychotics can be very effective at reducing symptoms, but they often come a lot of additional consideration to keep in mind, like cost and potential for unwanted side effects like tolerance, dependence, and withdrawal. In contrast, people with schizophrenia require treatment with an experienced mental health professional such as psychiatrists. The professionals can prescribe medicines to help relieve symptoms. The bitter truth is that schizophrenia does not have as much public support and awareness as diseases like cancer or AIDS, and not as many people talk about schizophrenia. As a consequence, less people are informed about it. Living life with schizophrenia can be lonely, but it should not have to be that way. Together, we can change this, starting by not labeling people with schizophrenia as crazy. This prevents people with schizophrenia from seeking treatment. It also prevents people with schizophrenia from having a supportive environment. Okay. Next, try to understand schizophrenia on a deeper level. We are often afraid of things we don't understand. This is sadly the case in Indonesia, where many people with schizophrenia are sent away and confined. The more we try to understand schizophrenia, the more people with schizophrenia will be able to seek help and treatment without fear of stigma. Now, to sum up is, people with schizophrenia are not dangerous. They are just sick people like most of people in general who need medical help. In conclusion, my recommendations are, we can change by starting not labeling people with schizophrenia as crazy. This prevents people with schizophrenia from seeking treatment. It also prevents people with schizophrenia from having a supportive environment. Okay, That's all of my presentation. Do you have any question? If you have any questions or suggestion, please contact me on WhatsApp. The number is on the presentation screen. Many thanks for your attention. Wassalamualaikum warahmatullahi wabarakatuh. Bye bye.